Hey everyone, some quick updates just about the navigation menu. So next time you're on MyTherapyWizard, you don't feel confused because things do look different. First of all, I'm logged in as an admin on a Teams account. Therefore, if you do not have a Teams account, if you're on a solo or a starter or a pro, you're not going to see anything below this. Or you also probably will not see the work list. I'm pretty sure you will not. The work list is for teams and just basically tells a therapist what's going on with their evaluation. But anyhow, what I want to make sure that you understand is that if you click clinical like this, you can see this little button and you can click that to expand it. So none of those things have gone away. Two things that we have renamed now, we have clients that used to be called students, and this is to help with the rebranding since we are not just working with pediatrics anymore. And then questionnaires used to be forms. So will remember that questionnaires are all of the questionnaires that you can send here. And so that is the change on that one. And then over in for the Teams account, you will see that your organization name will be here. Again, if you click here, it will close. So if I wanted to close the clinical, it's going to look like that. And I will just click to expand it, and then you will see the organization dashboard. If you open it, the caseload, team caseload, the forms and links, that's a new section for the Teams account. The supervision, the payroll, that would be your own payroll. And then let's go ahead and close that. Down here, this is now named management because usually admin will give permissions just for these areas. And so all of the areas that are sort of like the to-do list are now in this sort of amber orange color. So the clinical review, you can click it, and this will be for any therapist that is given certain admin roles or permissions to review plans of care, things like that. The needs action is here, and that is more for the admin permissions for billing. And then you have the members, and that's actually for your team members that you have invited in your Teams account. And then you have the practice settings here. And so you can see if I expand it, it opens up again. Just practice settings there that you will need in order to make the billing and everything work well. Districts and schools are still as they were, so that way you can define different districts and school areas. The templates is for, of course, the admin to be able to favorite different things that they want their team to use, such as assessments, questionnaires that they like, service templates, and report types. We have the flow settings. And also, again, remember this is all for teams, but the flow settings is set up by the admin, and sort of it can be moved around based on the way that your therapy organization works, and you can make any changes within here of who has responsibility for what and how many days that things should be happening. The forms manager is something that's pretty brand new and is here for each organization to create their own forms that they can send through email, or that they can post as a link and have their any of their customers or clients fill out. The payers and codes is basically there again to be able to add in their insurances that they're in or out of network with, direct payment groups, procedure codes, rates. Pay rates is how it understands how to pay therapists, non-procedure codes, and then we have modifiers. And then the billing here is, let me close that one down, is for service stops, consents, and eligibility. So that way you can receive those consents that come in through those forms and review. Eligibility runs are directly through MyTherapyWizard now, so you can review and see what's going on with all of your clients. We can do provider orders directly through here. I have a provider directory, provider assignment. And we also do authorization, so you can track your authorizations with any of your clients. And of course, when they run out of visits, it will notify us in the schedule and other places. You can run your claims, you can see your ERAs on any of them. You can submit here. Accounting would just basically, be just that. So you can see exactly what's owed. And then payroll is for you or for the admin to actually run payroll of your uh, clinical staff. And then we also have the analytics, which will look a little bit closer at denials, authorizations, business health, client trends, etc. So that is all. And please let me know if you need any help. And we're excited about this new feature or this new organization.